including public AI. And this is a framework that has been developed as part of an ESRC Digital Good Network collaboration between the Digital Good Network and Elgon Social Research. And it's also been funded by Responsible AI UK as part of the broader Public Voices in AI program. Next slide, please. This is one of the most wonderful ways to start a webinar, as someone just sort of magically sends a coffee over that you haven't even asked for. So bear with me while I balance it on my hand. Um, uh, Good afternoon. So this project, the Public Voices in AI project, involved reviewing 320 pieces of evidence about what the public thinks, surveyed over 4,000 AI researchers, produced a wide range of resources and toolkits, and undertook a national survey of over 3,500 people, and also funded all sorts of community organisations to involve the public in relation to AI. Some of these organisations were the Workers' Observatory and the Migrants' Rights Network. Next slide, please. And the sort of important question to explore is why we should do this. Why should we include public voices in AI? The first thing is very much around the potential benefits AI has, especially in the health context and setting. And we're really aware of the large-scale potential benefits of AI when it comes to making the most of the types of data we have about people's healthcare conditions, advancing research, insights, drug discovery, you name it. So especially in the health setting, AI has enormous potential to improve health outcomes. Um, it also is central to include public voices in AI in order to ensure that we can secure a social contract for further investment in AI for health uh, outcomes and improving health outcomes. So there is just something about public confidence and legitimacy. And a former colleague of mine often used to speak about it not just being important to show that a bridge being built was technically sound, but also it was important that a bridge being built is seen to be technically sound. Otherwise, it's never going to be a bridge that people want to walk upon. And I think that's a great analogy to draw upon here in relation to this point. So we have many health policymakers in the UK and internationally, and so what we're looking at here is about how we can empower policymakers to produce good AI policy, and support developers to build the type of society that people want, certainly in relation to health, but in all other kinds of public goods as well. And increasingly, AI, as we all know, is accelerating in terms of its impact on the health sector and health service. Um, there's also something important about addressing the gap in public voices in existing conversations. Actually, it's interesting to sort of see how technically dominant the conversation about AI is, whereas in reality, technologies such as AI affect us socially as well, and so there's a huge gap that we need to fill in shaping these existing conversations. And last but absolutely not least, we need to think about how we bridge the gaps caused by unequal AI impact and different capacities to influence AI systems. So one of the big challenges is that different people have different abilities to make use of the benefits that come from AI. This tends to be mediated by factors such as their access to digital technologies themselves, the locations in which they might reside, so digital infrastructure being really important, but also their own abilities to make the best possible use of technology. So here, social capital seems to be a really key factor in influencing inequities when it comes to the impact of AI on themselves and on other people in society. So these are some of the reasons for why we need to include public voices in AI. It's about recognizing that people experience the world really differently and also experience AI itself really differently, and understanding that better so that we can address some of the gaps that emerge from those differential experiences. Next slide, please. So, in terms of sort of engaging with some of these conversations or issues, I recently published a framework for including public voices in AI. And what this framework does is it sort of sets out theoretical and conceptual way of thinking about how we might do this differently, and sets out a foundational narrative for why we need to do this differently moving forward, drawing upon um, a large body of work established by, amongst many other people, Sherry Arnstein, who was a US health policymaker in the 70s. And I think that should interest people in the health space, which has been well ahead of the curve when it comes to thinking about inclusion and public participation. Very few people actually know that Arnstein was a US health policymaker, but I think that tells us a lot about the legacy of some of her thinking, which has been left behind, emerging from the health space, but also impacting upon. I think I just got muted, but basically I was just saying that Ornstein work comes from the health policy landscape, and in turn has impacted citizen participation, the way we think about citizen participation in many different fields. So there's a really long history and tradition and legacy of how patient involvement has influenced public participation outcomes. And I think that we should recognise that in this conversation. Next slide, please. So I mentioned Arnstein's way of thinking about citizen participation, and she was writing in the 70s, and she set out this framework called a ladder of citizen participation. Now this framework draws upon that because one of the things that Arnstein said defined citizen participation in its reality in a non-tokenistic way was the level of agency and power that it ascribed citizens. So her lens on citizen participation, including public voices, was that it was very much about shifting power. And if there wasn't any power being shifted, then actually citizen participation was happening in only a nominal or a tokenistic sense. So she spoke about the need to sort of move up a ladder of citizen participation away from manipulating people and simply informing people about AI tools and technologies all the way through to involving, collaborating with, and empowering people in relation to shaping many outcomes. She was thinking about health outcomes, but I also think AI is a relevant part of the health conversation as well. So the framework really draws upon Einstein's work and positions a spectrum of citizen participation centered on the focus being power shifting or enabling people to exercise increased agency and control over the direction and future of AI technologies. Next slide. So, I mean, this is really sort of depicted here. So you saw the spectrum on the previous slide, but the way Arnstein depicts it is as a ladder. So, she starts from this idea that people have no power. So they are being done to in some ways, more controversially and really dated at the time. She referred to therapy. So I'm not sort of saying I endorse that. So we've certainly dropped that from our narrative. But she also talks about manipulation, which is really relevant in a world where AI technology has more potential to sort of direct and influence and shape people rather than give them agency and power. And then she talks about things like placation, consultation, informing as being much more tokenistic. What she describes as high power method tends to be things like citizen control, delegated power, partnership. And we actually see that in the sort of tradition of health participation and inclusion when it comes to policy making, when it comes to some of the more collaborative methods such as citizen jury, panels, lived experience advisory boards that we now seem to see as widespread in health policy making. Next slide, please. And so obviously one of the big challenges when we're thinking about AI itself is that we risk being quite siloed and narrow in our thinking about participation. in shaping AI. And in the context of a health system, this is particularly important because, as we can see, many of us have probably already noted, AI is embedded within a much more complex system of institutions, people, structures, tasks, activities, and also situated within the constraints of our planetary boundaries in a wider complex environment. So the question of where people can participate isn't just in relation to AI development and deployment and procurement and use, although it can be in relation to those spaces. So I'm suggesting in the framework an eco-socio-technical lens. So upstream, when it comes to the use of the data, driving and informing AI. So there's another report that I've written about participatory data stewardship, and I'm really thinking about that here. In relation to decisions made about when to use AI, the cost benefit analysis, questions as to whether it will work, whether other approaches might do just the same job, and then tensions and trade-offs. So, what are the other goals being impacted at play? So, for instance, um, and apologies for the issues with the technologies. I'm back here again. So I was talking about upstream of participating in relation to the ecosystem. There's also midstream, so unpicking knots across the AI life cycle. So I was talking about the process of developing, designing, implementing, embedding AI, procuring AI. So participation in relation to shaping the development process itself, but also downstream. So thinking about how AI might affect uh, individuals over a period of time, the impacts of AI upon wider society, recognizing that AI doesn't really end. There's not really a finite point at which it stops, and itself learns from and is trained by real-time interaction. So there's actually a kind of conversation about shaping and being included in shaping AI at that level as well, in a much more continual way. There's a conversation at the moment about institutionalization of public voices in relation to AI. So through thinking about things such as citizen assemblies or panels that are much more enduring and ongoing in order to ensure that those accountability processes are in place. Next slide. So the important thing to recognize is that the path to participation in AI and inclusion doesn't really run that smoothly. And my colleague Rowan Conway worked on this really interesting diagram, which really depicts the system immune response. She described it to efforts to introduce innovations into systems. So that was her lens. And so this diagram has been adapted to illustrate some of the barriers that mean that actually it's not easy. It's a bit of an uphill struggle to embed inclusion and participation in the way we develop AI tools and technologies, especially in the health setting context. And so you've got this sort of wall in the way of scaling and systems change. So if we're thinking about inclusion and participation itself as innovation, um, one of the most clear barriers is competing incentives, mostly commercial incentives, but also the incentives of cost reduction and speed, market readiness as well. So just people not really knowing what. So one of the things really interesting is our survey of AI researchers illustrated that very few AI researchers had even heard of what a citizen jury is. So actually not a low level of awareness of different methods and ways of including public voices is really prominent. Regulatory frameworks that don't really reward being careful, thoughtful, or lack of regulatory frameworks in some instances, media backlash, procurement as well. So sometimes actually participatory and inclusive innovations themselves have to go through really long procurement processes, and that might slow things down, ironically. and then cultural norms. I've sort of already spoken about this, but this being very much seen as not the right way to do science and health, which tends to have a much more sort of top-down, expert-led institutional culture. These are some of the things that get in the way of inclusion and participation in science and technology. So we start with this sort of really interesting series of ideas of how we do this, but we always encounter this kind of pushback from the system. So one of the things the framework's talking about is until we address some of those factors that get in the way, it's going to be really hard to overcome them. So it's not, the world is not going to be changed by one citizen jury or lived experience panels if we can't develop strategies to address that little box in the middle, the blockers in the way. Next slide, thank you. And so one very small contribution to that sort of the box in the middle has been as part of our very short-term program as the development of a self-assessment workbook, which presents to many people who are doing inclusion for the first time or participation for the first time. It presents 12 dimensions for them to sort of self-assess again when they are thinking about how they might be engaging with members of the public in shaping AI technologies. So this can be adapted to the health context, but it can also be used in other settings and other contexts as well. It's drawn upon really a review of the literature that I spoke to earlier, but it's also drawn upon significant experience in undertaking public participation initiative for many, many years. At the heart of this workbook is the sort of values of why is it that we are doing what we are doing. So I will speak to all dimensions now. Next slide. When it comes to the values of the engagement, understanding who is most affected by the AI technologies, who are the beneficiaries and the key stakeholders, who's got a stake in the use of this AI tool in a health setting and service is really important to think about. So that might be clinicians, it might be managers, it might be a diverse workforce, it might well be patients, but it might also be people who are not currently represented in either data set or who do not directly experience the health service in many different ways. So here I'm sort of suggesting we move beyond the sort of data subject conceptualization towards a broader question or conceptualization of who is a beneficiary of a health service. And here, I think in one way, we're all beneficiaries of a health service, which moves towards this sort of idea of the health citizen, not just the health consumer. Ethical, religious, and cultural sensitivity. So here, understanding that people might be affected in really different ways because of their different norms, cultural backgrounds, standpoints, religious beliefs, and so on. Understanding that and seeking to represent that is really important. Equity, inclusion, appropriate inclusion mechanisms. So here's a set of questions about how to identify what the gaps are and understand what they are, drawing upon existing evidence, and then actually taking steps to narrow those gaps or level the playing field when it comes to participation. There's always a risk that participation actually just reinforces asymmetries of power. There's also this question about an ethics of care and mutuality towards communities and citizens. So a real risk actually that participation becomes a very extractive process and that we don't think about the return. So what do other people get from being part of shaping this direction of travel? So it isn't just all about the AI technology, but it is about the communities or the groups being included themselves. And then independence and trustworthiness of the process is also really important as a core value. Making sure that people can feel confident that their views are being understood and mediated effectively. Next slide, please. And the quality of a process matters too. So many engagement processes don't actually publish their report, and that's deeply problematic. So public gallery, accountability and transparency. I also see particularly bad practice by tech companies. I've seen quite a few examples of tech companies doing engagement and then not publishing the findings of that engagement. So proportionate time, resources, and support for inclusion is really important, as well as sort of actually evaluating the impact of the engagement process. And some, the science-wide program is a really good example of a program that evaluates every single public dialogue that it runs. But that's actually still quite rare. And next slide. And the responsiveness of the process, that actually what happens as a result of that process, is really important. So who owns that process, or at least is stewarding that process, is a really important question. So and understanding why and what is their role, and if there is an owner or steward. And it's worth noting here that the steward can be bottom up, can come from civil society, can be not non-institutional, as well as I suppose what you might describe as more top-down policy organizations and networks. And actually, the debate is moving into a position where many people suggest that as long as the bottom-up processes have valid and legitimate theories of change, they have the ability to exert and influence change in the same way as those owned and commissioned by policymakers. So there's a really interesting conversation at the moment. But the important key thing here is about the sort of who's involved, why, and who sets the agenda, and the extent to which the agenda is open to being set by people who are engaged and involved in the process. It seems almost obvious to say that this, but I kind of want to state the obvious, which is clarity about exactly what AI use case, in what context, and what strategy is being consulted on. So actually, a few years ago, I saw these rather sort of nebulous dialogues and deliberations about AI in general, and the better one, so one I ran recently on waiting list prioritization, was really clear as to who the policy owner was, what the technology was, the setting, and the parameters and limits of deliberation. And there was a really clearly designated technical body within the National Health Service Trust that was involved in shaping that. It was one of the best deliberations I've been part of or have run. Clarity of purpose and scope is also really important. So that's sort of what's on the table for discussion and deliberation, and what's not. And then just general commitment to act as a result of what's come out of those processes. So I think it's important to mention this in the context of a health service, which has a really tricky sort of track record of not always doing that. So I was involved in running an initiative called NHS Citizen many years ago. It was one of the highest profile deliberation activities, but unfortunately the board of NHS England didn't follow through on its sort of responsiveness. And in a way, it would have been better if it had been a smaller scale process with more kind of skin in the game. So that's some of my learning that's going into that. So that's the workbook, that's the framework in its totality. I think we've got plenty of time for questions, tech issues notwithstanding. So I'll leave it at that. And thank you very much for your time in listening to this conversation.
Thank you, Reema. That was fantastic. And I